Hi everybody, my name is Andreas. I'm the Director of Audiology at Hearing Solutions, and today I want to talk to you about earwax. So earwax, whether you think it's a fascinating topic or just plain gross, is something that we get questions about all the time. People are always coming in worried about, are their ears dirty or what can they do to clean it? And so this is something that we get lots and lots of questions about. So I thought it would be a timely thing to share and just give people a little bit of education on how we manage earwax and what we should do both in the clinic and at home. So first and foremost, earwax is totally normal. Some people think that it is, suggesting bad hygiene or something, and that's not the case. A normal amount of earwax in our ear is actually a good thing. Earwax is serving several important purposes. Our body's producing it on purpose. It's a collection of oils produced by glands in the ear that are there to keep the ear moist and lubricated. They're keeping the skin healthy, preventing bacteria and infections. They're even a natural repellent for things like bugs. And so it's there on purpose. The wax then allows dust and debris and dead skin to get collected, and then the ear can essentially ship it out of there and get rid of it in a normal fashion. And so what a lot of people don't realize is that our ear is self-regulating or taking care of itself. It's self-cleaning. And so in most cases, we don't have to do anything to manage our earwax because our body's taking care of it all on its own. What tends to happen is deep inside of our ear, we have our eardrum. And so the skin grows from the eardrum outwards, and it moves very, very gradually, kind of like a very slow conveyor belt. And so it's taking along with it dead skin and dirt and dust and debris and anything that doesn't belong in the ear, and it's shipping it out of there again. As it works its way to the opening of the ear, then when we're bathing, whether it's shower or bath, whatever, you go in there with a cloth or your hand, and you're able to remove any of that wax that's on its way out anyways. And that's the best way to manage earwax, is to let the body deal with it on its own, because then we're not disrupting the system. Because anytime you try and go into the ear and put anything in there, you're working against that gradual conveyor belt that's working outwards. And so for most people, you leave it alone and your ear will take care of any earwax all on its own. And since it's not super polite to go looking inside of people's ears anyways, nobody will even know how much or how little there is in there. Everybody's a little bit different, and so the consistency of wax and the amount of wax one person produces versus another is quite variable. It varies from one person to the next, and so there can be big differences in terms of how much wax and the consistency of the wax from one person to another. Now, some people, regardless of the fact that I've said you shouldn't go in there and mess around with anything, will want to go and take it a step further and do something about their earwax anyways. And so one of the more common things that people are wanting to do is they're going to resort to something like a Q-tip. And what I think is interesting about this is if we look on the box, actually, the box almost always has a warning on there that's telling people not to use them in their ears. If they are using them in the ears, they're just supposed to be going in the outer part of the ear. And so you're just supposed to be going in this concha part of the ear there, and you're not really supposed to be going any deeper. Nevertheless, I've told people this countless times, and I know that some of them will go home and they'll say, okay, Andreas, I'm not going to do that anymore, and they'll go home and do it anyways. And so if you're going to avoid the instructions on the box and the advice that I'm giving you today as well, one of the things I would at least say is that if you feel the irresistible urge to use a Q-tip anyway, what I would at least say is choke up on it a little bit so that when you are going in the ear, you're reducing the risk of harm, because you can't go any further than you're holding it. That way, if you're at least bumped or jostled, you can't, you're limiting at least the risk of trauma that you can cause in the ear. Because one of the things we're worried about when people are using things like Q-tips is that you go in too deep. Let's say you sneeze and you can cause a reflex because of a tube that joins to your throat there, and you cough or sneeze, and so then you get jostled and you go too deep, and you can cause trauma to the eardrum, even puncturing it, and you can cause some damage that way. There have even been horror stories where, you know, you go in too deep, you puncture the eardrum, you cause a meningitis infection that goes into the brain, and could even result in something like death, which would be a very silly thing to happen when I've just told you that, you know, in most cases, we don't even need to bother cleaning our ears. So in general, I would say don't even bother. Some of the other risks that we have when we're using something like a Q-tip is that you go in and you pull the Q-tip out and you see the discoloration, showing that you've got some wax in and you feel good about yourself because of that. What you don't realize is that in many cases, when you've gone in there, you've gone and pushed some wax deeper in again. So if you got some out, but you've also pushed some deeper in again. And that's working again against the way the ear is naturally trying to move the wax outwards. And so you're actually doing yourself a disservice, because while you get a little bit of wax out, you may push some deeper in there. And that can even result then in a blockage, because you can cause a little bit of a traffic jam, so to speak, in there, as the ear is trying to migrate things outwards if you push it in deeper again. So in general, let's do away with the Q-tips and not bother. Since most people don't need to do anything about managing their earwax, the buck stops there, and we don't have to do anything further. That being said, as I mentioned, everybody's different. People have different shapes and geometry to their ear, and so that can result in wax accumulating or building up in some cases. The elasticity of the ear is different in some people. The amount of wax they're producing is different in different people. And so for some people, they end up with accumulation of wax, and that can result in a blockage. And so a blockage of wax in the ear can become a problem that we would want to manage. The problems it can cause are reduced hearing, first and foremost. So if people are having problems hearing, and it's not due to any other causes, wax is certainly a possibility. And when we're doing hearing assessments, it's one of the first things we're ruling out. We're looking into the ear, and if there is any wax accumulation, we're often just removing it proactively to make sure that it's not going to affect the test results, and it's not going to be a problem. So for those people who do end up with a blockage of wax, we would urge them to come into our clinic, and that's something that we're managing on a regular basis. And so one of the ways that we manage that is with a tool like I have here called a curette. And so curettes come in different shapes and sizes, but the one I'm holding right here has a light source built into it that shines through. And then when we're going and doing work inside the ear canal, it's illuminating the ear canal very nicely, and we can see what we're doing very, very well. And so what we would do with a tool like this is we'd go in there and you'd essentially scoop out any of the wax that's built up there. We try and get behind it in most cases and get it out as a single piece if we can. But as we said before, the wax can have different consistencies. And so if it's very soft in some cases, we end up having to debride or run the tool along the tissue in the ear canal. While doing cerumen removal or wax removal like this is generally painless, it can be uncomfortable in some cases, especially if the wax is sticking to the skin or if we're having to use the tool against the skin there. Because I don't know if you're able to see, but the skin is actually very, very thin in some of these portions, and it can be resting right against the bone, especially on the deeper part of the ear canal. And so it can be quite sensitive and tender there, and so some discomfort is possible when we're doing a wax removal, but often we're able to do it with very little discomfort at all. In terms of the risk of harm, because we're seeing what we're doing, the risk is fairly low, and so the risk of trauma or damage to the eardrum is extremely low because we're not going to be working that deep outside of our comfort level. The risk of damaging the skin or tearing the skin is possible, especially for people who have very, very thin skin to begin with there, or whose skin is a little bit more prone to tearing there. But in most cases, it's very, very low risk of harm, and it's not typically uncomfortable. That being said, as an audiologist, one of the things we're doing is we're going to assess the situation and determine what the best way to remove the wax is. And in some cases, we're going to use water. And so we might use a tool, something like this, where we are placing a little tube into the ear canal, and then we are pumping water into the ear. And that's going to allow the water to go into the ear, we'll go right up against the eardrum and then flush backwards out again, and then we'll catch it in a basin. And so the flushing the water against the eardrum in that fashion isn't harmful at all. You can hear it, and so it makes noise. It can be noisy, and so not everybody likes that sound. Many people actually find it a comforting feeling, but in most cases it's not uncomfortable. It can make some people feel dizzy or nauseous depending on how different the temperature of the water is from our body temperature. But in most cases, flushing again is very, very comfortable, or not an uncomfortable process for the vast majority of people. And so often we're going to use both of these techniques, again, totally depending on whether the quantity of the wax that's there and its consistency, whether it's soft or hard, whether it comes out as a single piece or not. And so these are some of the common ways that we're removing wax from the ear canal on a regular basis. There's a third way. Suction is also a possible way of removing wax. It can be a useful tool, particularly if the wax is soft. That being said, there are some increased risks of harm with it, and it can be a noisier process as well. And so it's not one we resort to quite as often. Our two favorite techniques are typically using the curette and flushing with water. And this type of flushing system that we're using is generally a lot more comfortable than some of the syringes, the silver syringes that are quite common in some physician offices. So those are some of the common ways that we would manage wax. One of the things that I haven't had a chance to talk about just yet is softening wax with oil, which is also a very common practice. It's something that we do in the clinic and is also safe for patients to do at home in many cases. So for people who have a wax blockage and the wax is very hard, that can be uncomfortable when we remove it because it can be sticking to the skin. And then when wax is pulled away from the skin, it can take some skin with it. It can even cause a little bit of a bleed in some cases. And so that's not always ideal. And if we can get away from working with wax that's very hard and dry, we would prefer to do so. And so sometimes we'll soften the wax in the clinic with oil or advise patients to soften the wax in advance at home with some oil. Now, we don't want to use just any old oil. The oils that tend to work the best are baby oil or mineral oil. That's very common. And we just use a few drops. So you tilt your head over and you put a couple drops in with like an eardropper. You rest the head that way for a little while until the wax can soak up the oil, and that will soften it and make it much, much easier for us to remove. In many cases, when people are proactive in doing this at home, especially if they know that they're prone to wax blockages, it allows the ear's self-cleaning methods to work on their own as well. And so you stop that sort of blockage, and the ear is able to manage its own care once again. So some people are able to just prevent their wax from blocking up when they're regularly softening in that fashion. There are some over-the-counter products that you can use as well. And so those typically, the ingredients within are agents like mineral oil. And sometimes they'll have things like peroxide in them as well that will help give a foaming action, and that can help break up wax blockages too. But these are some of the common ways that we're able to help people with wax blockages. Wax blockages like this are very common, and as I said earlier, they can result in hearing loss. That being said, we are removing wax on a regular basis, so we are happy to support our patients in managing these things, and I hope that the education that we've been able to provide people will help them in not worrying about having to clean their ears so often unless they know that they're prone to wax blockages. So hopefully you found this helpful. If you need any other support or advice, please don't hesitate to contact any of our Hearing Solutions clinics, as we would be more than happy to help your hearing healthcare needs. Thanks.